Welcome to the PBM Insider. I'm Jim Lodge, an actual PBM insider. When people hear that prescription drugs account for only about 9 to 10% of U.S. healthcare spending nationally, but then see pharmacy representing 25 to 30% of employer-sponsored health plan costs, it sounds like somebody's data reporting is way off. But it isn't. The gap between those two numbers exists because these numbers use very different denominators and accounting rules. Nationally, the most cited statistic comes from the Centers for Medicare and Medicaid Services National Health Expenditure Accounts, also known as CMS. CMS reports that retail prescription drugs made up roughly 9% of total U.S. healthcare spending in 2023. That denominator includes everything spent on healthcare in this country: Medicare, Medicaid, long-term care facilities, nursing homes, and the list goes on. It reflects the entire healthcare economy, unlike a benefit plan. Employer-sponsored plans, by contrast, use a much narrower denominator. When employers calculate pharmacy as a percentage of total spend, they are dividing pharmacy claims only by the costs their plan actually pays: medical claims and pharmacy claims, primarily, along with perhaps some stop-loss premium and other vendor administrative fees. Entire categories that weigh heavily in national spending, like VA benefits or Medicare and Medicaid, are simply not part of the employer equation. That smaller denominator alone makes pharmacy a much larger percentage of the expenditure among the employer-sponsored plans. This is why these numbers can be true at the same time. National statistics are making drugs look like a lower percentage by spreading them across a massive healthcare denominator. Conversely, employer-sponsored plans operate with a much narrower definition of that denominator, but they certainly still feel the full impact of drug costs, making pharmacy a much larger share of their total spend. This is the PBM Insider, keeping you informed.